And it's not only the consumption, but it's also the products. Before, what we knew was the cigarette and the pipe and the chewing. But now there are other forms of tobacco. There's chewing gum, which has come up, the kuber and other types like that, which are packaged nicely and flavored with vanilla, strawberry, and all manner of things to make it acceptable. And unfortunately, most of us cannot identify it as tobacco, so children are taking it into school undetected by the authorities. Even in the homes, there's a lot of shisha that's becoming very popular in hotels. I think a round of 30 minutes is now 25,000. So they are coming up with more products. The consumption is going higher and the products are also increasing.
Anti-tobacco use activists say if current trends continue, the number of annual tobacco-related deaths is predicted to increase to 10 million by the year 2020, with 70% of those deaths occurring in low and middle-income countries. This means that tobacco is the single greatest preventable cause of death in the world today, killing up to half of the people who use it. Activists have found it necessary to have a law in place to regulate the manufacture, sale, labeling, promoting and advertising of tobacco products in Uganda. Many health problems are associated with the consumption of tobacco. Janina Kabiswa, the capacity building specialist with the Center for Tobacco Control in Africa, notes with concern that the consumption of tobacco has increased to 14% among the youths, which needs to be checked. She says government needs to expedite the enactment of the tobacco control bill to have this addressed.
What happens is as countries in Europe have more stringent laws, the industry finds it harder to work. The tobacco industry finds it harder to work, and the trends have shown that there's a move from there to Africa, and of course Uganda inclusive, to areas that are virgin areas that have no laws to control tobacco consumption. So that's why we're concerned, because the Global Youth Tobacco Survey that's done by WHO has shown that the consumption rate among the youth is increasing, both the girls and boys. The girls are a little lower, but the boys are higher, I think at 14.5. You know, that's something that we didn't have 10 years ago. So when the statistics begin to show, you get concerned.
Uganda is lagging behind other East African countries like Kenya with respect to having legislation on tobacco control. Kabiswa adds that the Minister of Health will be empowered to set penalties and punishment for offenders.
What happens is, as soon as the bill is passed into law this year, the committee, there's a structure in the law. The Minister of Health is the minister that will work with the committee that's proposed, the structure that is proposed in the law, and they will outline regulations which detail what should happen under each article. So the law is comprehensive, but it does not give every detail of every penalty that should take place and fines and things like that. So as soon as it's passed into law, then the committee, headed by the Minister of Health, get together and they draft regulation.
The Tobacco Control Bill provides for price increase through taxation on the tobacco products as an effective intervention in reducing demand for tobacco. According to Dr. Deogracius Kahiru, people should be informed about the effects of tobacco use if the vice is to be fought. He cites lung cancer among other health problems associated with tobacco consumption.
Definitely cause you harm either in terms of disease or eventually in death. Actually, each cigarette you take reduces your lifetime because of its effect on the different parts of the body. So for that reason, it is a duty for health workers and all other citizens to make sure that people do not die of something which is known to be dangerous.